Okay, thank you everyone for joining us for this second session of the RaCEEs course. Today we're going to talk about key attributes of an economic evaluation. I'm going to introduce myself. I usually do that in the first session, but I couldn't be there for our first session. I was replaced by Luis, who did a great job. My name is Valerio Benedetto. I'm a research fellow at the University of Central Lancashire, and I'm the health economics lead for the methodological theme, the ARC-NOERS course, which is the MIDAS theme. Just to remind you, this session will be recorded and made available on the ARC Nowhere Coast YouTube channel. But if you have any questions about the recording, please let us know. Right. So what we're going to do, first of all, is have a look at the economic evaluations for our commentary. So I just want to thank you for completing the homework. It was really nice to see many people completing the homework and send us the economic evaluations. Now, the team leads had to make some tough decision around the preferred economic evaluation for your own specific team. And I'm going to list the economic evaluation here now. This is just to remind you, everyone, that this is just a paper we are going to use in order to learn more about economic evaluations, right? So we didn't really make a decision around, we prefer this specific paper because we like this specific bit. It's just because it aligned a bit better with things we're going to learn during this course. So it makes things a bit easier in order for you to understand the components of economic evaluation. So the paper is just a vehicle in order to learn a bit more about economic evaluations. The PDF of the article is already on your TeamSpace, so you can open your TeamSpace after the session is already there, and you're going to use the PDF in order to complete the homework for this session and the next few sessions. So these are our team: cancer care, mental health, and nutrition. For cancer care, we chose the paper on self-sampling strategies for HPV primary cervical cancer screening compared with clinician-collected sampling. So I think this paper was chosen by Gillian, if I remember well. Tamer, you chose a really nice paper as well, and it was really tough to decide, I have to say. The only, I think, edge with Gillian's paper is about the modeling, which is a bit simpler to understand. So I think we went with this one because the modeling is a bit simpler, and as I was saying before, it aligns a bit better with the things we're going to learn during the course. But Tamer, you chose a really good paper as well. And if in future you want to do a RaCEE around that paper, yeah, we can of course help you with that. For the mental health theme, we chose this one, which is an economic evaluation of a complex intervention, which is called Engager, for prisoners with common mental health problems near to and after release, a cost utility and a cost consequences analysis. We will learn about these terms during today's session, by the way. And this paper, I think it was chosen by Fazan, and Luis and I had a chat last week. As I was mentioning before, Maria, thank you for completing the homework. I think we went to this one again because it's a proper economic evaluation with the different components which aligned a bit better with the things we are going to learn today and in the next few sessions. And finally, on the nutrition team, which is led by Michelle, we got this paper, Cluster Randomized Control Trial and Economic and Process Evaluation to determine the effectiveness and cost effectiveness of a novel intervention, the Healthy Lifestyles Program, to prevent obesity in school children. Michelle, do you want to say a bit more about this paper?
Yes, so this is actually it's a package of research. So it was an RCT, a randomized control trial. There was also an economic evaluation, and also there was a process evaluation. So all together in a package of research. So we will focus on chapter 4. Unfortunately, the RCT haven't shown any results. So consequently, the economic evaluation is saying that, look, we don't have results, but still they are doing some economic evaluation. So I think it's a good paper in the sense that it's very honest of what it's trying to to evaluate. So there is no effect. So then the cost effectiveness in the confidence intervals also, it didn't have any cost effectiveness analysis. So it shouldn't be implemented. But I think it's nice because after all, we will try to learn this kind of methods to try to assess honestly if an intervention is going ahead or not. So for that reason, I think it will be nice to follow this study. We haven't chose that, so there's one student who chose this, so we're happy to go ahead with this.
Thank you, Mizel. Faizan, I think I admitted you into the call now. So nice to meet you, Faizan. Good morning. We are just on the second slide. We were talking about the economic evaluations paper we chose that we're going to use during the course. Okay. Any questions about these choices? Any questions about the homework? Anything in particular you want to clarify? Okay. That's great. So we'll move on. So this is session 2. We are going to start talking about the methods of an economic evaluation. We'll focus today on the key attributes. And then session 3 will focus more in depth around the costs, how to measure, how to identify costs. And session 4 it will be about the outcomes. And then the session 5 is all about the results. So how to use all the data in order to formulate some key results around the cost effectiveness of interventions. And then session 6 is a final online session with the Q&A, and we will talk a bit about the introduction section of our commentary. And then the workshop will be the face-to-face part of our course. It's going to be on the 2nd of September. And I'm just going to remind people, if you haven't responded to the calendar invite yet, please do so in the next few days if you can, because we need the numbers to organize the workshop, things like catering, for example. So we need to know the numbers pretty soon. Thank you. So in terms of the overall sections of our commentary, so the final output, as you know, is going to be a commentary of an existing economic evaluation, in particular the economic evaluations we were listing before. This commentary will have different sections. Typically, we will have 4 sections which we are going to work on: the introduction, the method, the results, and a commentary discussion section at the end. So this is an academic paper which is going to be quite short. Usually we write it using 2,500 words or even less sometimes, depending on the specific journal's requirements. The introduction session is to give a bit of information about why the economic evaluation is important. So we will try to find this information from the paper directly, but also from other sources. But it's something we are going to dedicate our time after session 6. So this is probably, this is going to be the last bit of our work. Starting from today, instead, we are going to focus on the methods. So part of your homework after today's session is to find some information within the paper. And the paper, as I was saying before, is on your team space already. So you will have some homework which will be focusing on finding some information about, for example, the key attributes of an economic evaluation. And then after session 3, you will identify some cost data. After session 4, you will identify outcome data. And then after session 5, instead, there will be homework regarding the results section, which I'm going to focus, as the name suggests, around the results of the economic evaluation. And then at the workshop, we'll concentrate on the commentary bit. So in a way, we will split the responsibilities between you, the participants, and us, the team leads. So you will be tasked with extracting information each week, and the team lead instead will write up all that information in the method in the results section of our commentary. Okay, so it's a 50-50 job, basically. Okay, for today's session, the aim is to understand and describe the key attributes of an economic evaluation. And we will talk about the interventions of an economic evaluation, including population and location and setting. And then we'll focus a lot on the analytical approach on different components, like the type of economic evaluation used in a study, the sample size, the perspective, the time horizon, and the modeling techniques. So there's a lot of information. I'm going to check my watch as I go along because I don't want to overrun, but hopefully we will finish by 11. If you have any questions, please let us know, okay? Please unmute yourself and let us know. Okay, we'll start with intervention. So an economic evaluation will always compare two or more interventions. This could be, for example, a new intervention, a new drug, a new therapy, a new type of surgery, which is compared to something else, usually that is usual care, standard care, the best practice, which is utilized in the health or the social care system. But it is important to understand that more than two interventions can compare. So there might be maybe some examples in the economic evaluations that you chose that there are more than two interventions. So, and that's something we need to keep in mind. In terms of what you'll have to do after today's session is to open the PDF of your article and try to find some information about the intervention. Usually this information will be in the method sections. So you will try to identify, for example, the population. Population is the people, the patients which are going to be targeted by intervention. So it could be, example, people with stroke, people with diabetes, smokers, for example. And so you will need to find information about the type of disease and condition which affect that particular population. The second thing is around the type of intervention, could be a pharmacological intervention, psychological intervention, and so on. And also how they work. If we are talking, for example, about a drug, the type of administration, the frequency, and the doses, these are all type of information we would like to extract from a paper. The therapy, again, if it's a therapy, the number and type of session, the frequency, who delivers and who receives them. If it's a diagnostic tool, I think we got one paper on diagnostic tools actually, so the characteristics of scan, test, and so on. And finally, the location, so geographical location, but also the type of care settings, whether the intervention is applied to, for example, primary care, secondary care, or a mix of different care settings. And I'm going to show you now an example on how to extract these characteristics of an intervention from a paper. So this is something you can follow in order to do your own homework after today's session. The population receiving intervention should be clearly outlined within the aim of the study. So actually, this is something you might be able to find in the introduction section of the economic evaluation paper. So if you open the article and go in the introduction section towards the end within the aim of the study, you should have a clear definition of the population being targeted by the intervention, which the authors were trying to examine. In terms of the type of intervention, how they work, these typically will be in the method section, could be in a subsection called interventions, for example, or similar, but not always. So it depends on the way, journals require people to position the information in the method section of their papers. Geographical location settings could be described within the aim of study, but typically you might be able to find this in the methods. And this is an example from an article we used some years ago now. We used this article by Chowdhury et al. It was an article on advanced Parkinson's disease. And we used this economic evaluation in order to formulate our first RaCEE, our first commentary. And we're going to use this article a lot in this session and in the next few sections as an exemplar of how we did the work and also how we're going to do the work together during the course. So if you have a look at the article, in particular the extract from the introduction, you got some information about the population here highlighted in green, so patients with advanced Parkinson's disease. You got some information highlighted in yellow or orange regarding the interventions. So in particular, the authors were investigating the cost effectiveness of this particular intestinal gel relative to standard care. So you got two interventions here, two comparators. And if you look at the methodological section, you will also be able to find some information how standard of care works. So in this particular case, includes oral Parkinson disease medication with or without subcutaneous apomorphine infusion or injection. So these are information regarding the administration of standard of care. And also the location, which is England. Now, this example of a previous RaCEE, you can find it on your team space. There is this folder called example previous RaCEE, and you will be able to see our commentary, which has been published in 2023, yes. And this is the way we summarized the information regarding the methods, in particular the population, the type of interventions, and how they work. So you can have a look at our published RaCEE, and you can have a look also how we wrote things up in that particular RaCEE. But remember, you are going to be tasked with extracting information. The team lead will write things up, so don't worry too much about how things are written up. I'm just going to present them here just for your information, basically. Any questions so far? Just check the chat as well, okay. Okay. So in terms of the analytical approach, we're going to have a look now at the types of economic evaluation that could be used in a study. We are going to look at three components like the sample, the perspective, and the time horizon. And then we are going to focus also on the modeling techniques towards the end of the session. Now, this is going to be a very big table now I'm going to present you, and it will list all different types of economic evaluation. So similar to, for example, randomized control trials or other type of study design, you have different types of randomized control trials, for example, different types of core studies and so on, or observational studies in general. It's the same for economic evaluations. So there are different types of economic evaluations, and I'm going to present these types in increasing order of complexity. So the first one is cost minimization analysis. You might have heard of this term before. In cost minimization analysis, we only focus on costs. So we don't have any consideration around the consequences, the outcomes of a particular intervention or two or more particular interventions. And if you look at the example here on the last column, in this hypothetical study, the authors were comparing the cost of administering a therapy to treat hypertension using two alternative modes of delivery, considered equally effective. So there's no consideration around the outcomes because there is perhaps a strong assumption that these interventions were equally effective. The interventions in particular were A, in the delivery in the hospital outpatient setting, or B, the delivery in private homes by involving community health staff. Now, this very strong assumption about the equal effectiveness of these two interventions could not be realistic, or is unlikely to be realistic in a way. So cost minimization analysis is very uncommon because it relies on this strong assumption that the intervention is going to be equally effective, and that might not be the case in the real world. Instead, with the cost consequences analysis, we start to understand a bit how outcomes might differ between the interventions. So we got our costs, which are going to be measured in monetary units, but we also have a consideration around the outcomes or the consequences of the interventions. In particular, in cost consequences analysis, these outcomes, these effects, are going to be listed in a disaggregated format. So that means that if we look at the example here on the last column, we're going to compare the intervention in terms of cost, but also consequences such as acceptability on the part of, for example, of the patients or healthcare professionals, willingness to use, resource use, for example, how many medications people use because of the interventions, health outcomes, of course. So these are all different effects we are going to consider in a cost consequences analysis, but all separated, all listed in a disaggregated format. Cost effectiveness analysis instead, we are looking at a single effect of interest. So rather than listing things in a separate way as a CCA dose. In a CEA, in a cost effectiveness analysis, we are looking at single effect of interest. In particular, if we're looking at the example here, we are going to look at something like reduction in blood pressure, because of course we are considering a population here which is hypertensive people. So a very relevant outcome here will be the blood pressure of these patients. So whether the two interventions manage to reduce blood pressure in these patients, and whether they differ in the reduction in blood pressure. So the single effect of interest is typically measured in natural units. We got points of blood pressure reduction, but could be disability days saved, life years gained, or for example, if you're looking at diagnostic test, number of tests you're going to use, or number of people screened, and so on. Or also things like hospitalization averted, for example. That's another outcome you could look at. But it's important to notice that things might differ between different health areas. So if you're looking at hypertension, you might be interested in a reduction in blood pressure. If you're looking at stroke, for example, you might be looking at something like physical mobility. If you're looking at cancer, you might be interested in something else. So outcomes might change, of course, depending on the different health or disease areas you're considering. In order to circumvent this variation in terms of outcomes, we could use something like the cost utility analysis. Cost utility analysis is a subtype of cost effectiveness analysis. And again, we are looking at typically a single or multiple effects, but we're looking at something called healthy years in this case. Healthy years is typically measured by the quality adjusted life years, or QALYs. I'm sure some of you will have heard of QALYs before. And they are measured as a mix of quantity and quality of life. So the healthy years account for both life years gained, so life expectancy, survival in a way, and associated quality of life. So in this case, we are looking at a single composite outcome, where we estimate the quality of life changes and the life expectancy of hypertensive patients being treated. And why did I say that using a single composite outcome like health years kind of circumvent the variation in outcomes we will have to deal with in cost effectiveness analysis? Because health years can be applied to different health or disease areas. So having a measure that allows you to estimate quality of life changes and life expectancy will be somewhat relevant to people with cancer, stroke, diabetes, smokers, and so on. So it could be applied into different health or disease areas. And that's why cost utility analysis is very common in economic evaluation, and it's probably the most common type of economic evaluation used out there. Lastly, I'm just going to also mention cost-benefit analysis. So far you will have noticed that we always consider cost in monetary units, as you expect, and we are going to do the same here in a cost-benefit analysis. But in a CBA, we will also consider consequences, effects in monetary units. So we will try to quantify effects in a monetary way. For example, one way you could do that is by estimating how much the treated patient will be willing to pay for the therapy. So you're putting a type of like price into the therapy, and you try to compare how much value patients put onto the different therapies and try to monetize a bit the intervention and understanding the value of this intervention. CBAs are common, but not as common as cost utility analysis or cost effectiveness analysis in health economics. Now, this is a very big table, so I'm not expecting you to remember everything, but you're going to have these slides, and when you're going to do the homework, please do refer to this table and have a look at this table in order to understand whether the economic evaluation you're going to work on includes, for example, a CCA, a CA, CUA, and so on. Any questions so far? Perfect, okay. So how we extract analytical approach from a paper, looking at the types of economic evaluation. The first thing I will say, do not jump to conclusions. So when you open your PDF later, you will probably see the term cost effectiveness a lot in your paper. That doesn't mean that the authors conducted a cost effectiveness analysis. Okay, cost effectiveness is mentioned a lot in papers because it's used as an umbrella term in a way. So we talk about the cost effectiveness of an intervention, for example. It is basically equivalent to say the value for money of an intervention, but that does not necessarily mean that the authors conducted a cost effectiveness analysis, which is something different. Okay. To determine the type of economic evaluation, you could check the outcome measures used by the authors in the method. So if you go into the method section of the paper, you might be able to see, for example, that the authors used a single effect of interest measured, for example, by a reduction in blood pressure, so specific clinical outcome. In that case, you will know that the authors did a cost effectiveness analysis. Or if you see something like the quality just the life years, you will know that the authors did a cost utility analysis. So if they present things in terms of cost per additional quality or per additional health year. Usually or typically, the authors should be clear around which economic evaluations they used. For example, if you remembered when we were listing the papers before in the second slide, I think there was a paper which was mentioning they were doing a cost consequence and a cost utility analysis, right? So they were very clear, as even in the title, that those were the types of economic evaluations they were going to run and present as part of the paper. So hopefully you will have that information very clearly outlined in the paper. But if you struggle, we are here. So the team leads are here. We can help you with things, okay? And it's important to notice that people can use more than one type of economic evaluation, so they're not mutually exclusive. For example, going back to the article by Chowdhury et al. On advanced Parkinson disease, the authors here conducted a CEA, a cost effectiveness analysis, and a CUA, a cost utility analysis, because we have life years. So if you look at the outcomes, they consider life years, so the years that people live as a result of receiving the intervention, and qualities, which are health years, basically. So we got a cost effectiveness and a cost utility analysis here. Any questions? Okay. So I'm going to cover the sample and perspective and time horizon quite quickly. I think these are probably the easiest things to extract from a paper. So you will typically, again, I use the word typically a lot today, but that's where information are going to be in a paper, but it's not always the case. But you can expect a lot of these components, a lot of these attributes to be in the method section of the paper. So in terms of the sample, the information you are going to extract is the type of participant involved and the size of the sample. So sample differs a bit from the population because it will have more information about the actual characteristics that the authors wanted to include in terms of particular participants of the study. So if you're looking at, for example, a population of stroke survivors, the sample might include stroke survival with for example, mild mobility problems or with mental health needs, for example, or there might be some inclusion criteria regarding age, okay? So in a way, the sample will specify even more the type of population that is going to be investigated in that particular study. The size of the sample should be clearly expressed in the paper, maybe in the results section rather than in the method section, but I'll give you an example later on. Perspective. Perspective is, I think, a peculiar attribute of an economic evaluation, and it is something that you find specifically in economic evaluation and maybe not in other study designs. And it reflects the range of costs and outcomes considered. So if you're looking at economic evaluation, you might see that they are considering the cost and outcomes which are attributable to the health and social care system only. Okay, so for example, the cost for medication which are going to be paid by the healthcare system, the outcomes which arise only in a healthcare system particularly. There might be other economic valuation which consider, for example, patient cost as well. Okay, so whether there are any out-of-pocket expenses that the patients have to incur as part of receiving interventions, any outcomes as well that might impact on the caregivers, like whether they need to take time off work, whether the family or the patients have to employ a carer as a result of receiving intervention, for example. So as you consider more and more types of costs, and so not only the health and social care system cost and benefits, but also the cost and outcomes for the patients, for the families, but also for society more widely, you will expand your perspective. For example, you can think about productivity costs. So if people have to take up time off work in order to receive the intervention, or in order to recoup from an intervention, that means that companies might need to recruit another person, and temporarily or permanently. So these are costs and outcomes which we could consider. As a minimum, an economic valuation, especially in the UK, should have an health and social care system perspective as part of the analysis. Time horizon instead reflects the time scale of the analysis, which could be very short term. So if you're looking, for example, at an intervention where you administer some antibiotics for surgery, for example, you might look at the outcomes maybe in a 30 days period or maybe a couple of months period, so relatively short term. But of course, there might be instances where you want to look at things more longer term. So if you're looking, for example, at a smoking cessation therapy, okay, so there might be effects which extend to the lifetime of individuals in terms of potentially fewer comorbidities in the longer term and better quality of life. How do we find all this information in a paper? So the sample, for example, you will find the type of participants involved in the method section of a paper, and the sample size should be at the beginning of the results, actually. So it should be one of the first information that the authors provide as part of the results section. Perspective and time horizon will be included in the method, okay? If you struggle, I know it sounds very basic, but do a quick search for perspective, for example, or for time horizon, or just horizon. Any good economic evaluation in a way should include a perspective and a time horizon. So you will be able to do a Control F search and find the word perspective somewhere in the method and the word horizon or time horizon somewhere in the methods. Okay. If you struggle, do use this tip in order to find this information. Any questions? Okay. This is, again, another example on how to extract these three components, sample, perspective, and time horizon, from the article we used to develop our first RaCEEs. So if you look at the introduction of that article, there was some information around the perspective here. And as I mentioned before, we probably found this by just doing a Control F search. And we found the word perspective. So we know in this particular article, the perspective is that of the health and social care system in England in this case. In terms of the sample, we had some information in the methodological section of the paper. In particular, here we can see in pink that the authors were considered patients with advanced Parkinson's disease, which is a bit the population of the study, but with severe motor fluctuation defined by the Hoehn-Yahr scale and the off time, which the off time is in advanced Parkinson is when the medication starts to wear off and the symptoms of Parkinson might return or even worsen in some case. So that's the off time. And of course, the longer the off time, the worse are the conditions for people with advanced Parkinson's disease. So it's good to see here, for example, that the authors were considering specific inclusion criteria in order to define even more the study population. And you also have some information about the sample size here in pink. The time horizon instead, again, in methodological section, you'll find some information around the time horizon, which was 20 years in this case. So quite long term. And if you look at our commentary, the actual published RaCEE, you will also be able to see how we wrote up this information in terms of the type of economic evaluation used, the sample, and the time horizon. But again, this is just for your information. You don't have to write things up. With the team leads, we will work on that. Any questions? Okay, so I realize I'm giving you and I'm going to give you a lot of information around economic evaluations, and I think I mentioned already you don't need to learn things by heart. We don't want you to be like a fully fledged earth economist by the end of today. These are things that we are going to leave on the slides for your in order to help you when you're going to do the homework, basically. And that includes what I'm going to present now, which is quite complex. But I think it's good to have some, at least knowledge of modeling techniques which people use in economic evaluation. So at least you are a bit familiar with some of the terms. So if you see, for example, decision trees or Markov models or discrete event simulation in a paper, you can refer to these slides and refresh your memory about around what these things are. So modeling techniques or models, people use models in order to depict the patient pathways in order for that to be as realistic as possible, okay? So if you're thinking about a person diagnosed with cancer, they might have some initial consultation where they go through different types of potential treatments they might receive. And they might go, for example, into chemotherapy, radiotherapy, or, for example, just watch and wait. Maybe the condition are not so severe, so they will be re-examined at some point in the future without undergoing any specific treatment. So you can already see there is a probability for the patient to undergo chemotherapy, radiotherapy, or watch and wait scenario, okay? And from that, there will be other options. So if the chemotherapy might go well or might not go so well, so there might be some complication. The same for radiotherapy, okay? So these are all different things that health economists will try to model in order to approximate the cost and outcomes of the different interventions we are going to examine. So if people undergo chemotherapy, there will be certain costs attached to that. The same for radiotherapy, the same for watch and wait. And there will be different outcomes. So the quality of life will be of the patients, for example, will be impacted differently according to the different type of intervention and treatments people receive. And depending on the objective of the economic evaluation, the type of intervention and treatment, the type of health condition, the time horizon, different models might be needed to accurately capture benefit and cost. I'm going to present these different models, which are mathematical models at the end of the day, in increasing order of complexity, starting from decision trees, which is the basis of any type of model, I have to say. So it's often useful to start with a decision tree and then add a bit of complexity to that. And then we will look at the Markov model, which is a more complex extension to decision trees. And then an alternative to Markov models are discrete event simulations, where we are trying to, again, add a bit complexity, be more complexity and try to make the model a bit more realistic. Let's have a look at the decision tree first. So in this decision tree, you'll have a comparison between two treatments, X and Y. And if you are, for example, in a randomized control trial, you'll have a random allocation of people or some people to treatment X and the remaining people to treatment Y, okay? So some participants will go to treatment X and the other participants will go to treatment Y. What might happen is that with treatment X, there is a probability that you will get cured, and there's also a probability that you might not get cured. And the same with treatment Y. So probability you might get cured, which is indicated by PY, for example, and a probability you might not get cured, which is 1 minus PY. So if you think about, for example, the probability of being cured here is, let's say, 90%, then the probability of not being cured is going to be 10%. There's no other scenarios here. We're just considering two potential outcomes, okay? And the same for treatment X. If this probability of being cured, Px, is 75%, then the probability of not being cured is going to be 25%. Okay, so a patient might go to treatment X and get cured, they might end up here, or might go to treatment X, not get cured, they might end up here. And the same for treatment Y. So imagine you got 200 patients, there will be a proportion of people ending up here, proportion of people ending up here, another proportion of people ending up here, and again, a proportion of people ending up here. Depending on the pathway, you as a patient, let's say, you will accrue some costs and outcomes. For example, if you get cured, you will have a certain life expectancy, okay? And similarly, if you don't get cured, you will have potentially a lower life expectancy, okay? So there will be different life expectancy attached to the outcome of your treatment. Now, here we are considering things in terms of life expectancy, so we could have other outcomes, for example, QALYs, for example, reduction in blood pressure if you're looking at hypertension. So we are trying to simplify things here just by looking at life years gained and life expectancy. So these will be our outcomes or benefits or effects from an intervention, life expectancy, but as you know, we are considering a cost as well because we are running an economic evaluation, so we need to consider costs. In particular, there will be some cost attached to the treatment. So there might be, if you're looking, for example, a specific surgery, there might be some equipment we need to provide or the healthcare system need to provide. There might be some time on the part of a healthcare professional which we need to consider, and that means cost we need to consider. Drugs as well. So there will be some treatment costs we need to consider. And then for each year of life lived by the patient, there will be some ongoing costs. For example, you can think about regular medication or regular follow-up consultation that people might have for the rest of their lives, okay? Of course, this scenario doesn't apply to all types of diseases. Of course, there might be diseases where you get cured, you don't have any follow-up cost, and that's it. But of course, here we're trying to consider things a bit more in terms of a longer-term scenarios. Any questions so far? Okay. So the same considerations around cost will be applied to the other branches. Okay, so for each branch, we will have certain payoffs for life expectancy and for costs. Okay, let's try to put numbers. So maybe things will be even easier now with numbers. As I mentioned before, we have some probability attached to being cured or not as a result of receiving treatment X or treatment Y. In particular, if I'm a patient and I go to treatment X, I get cured, my life expectancy will be 30 years. If I don't get cured, instead, my life expectancy is going to be lower, 20 years. And the same for treatment Y. Cost instead, the treatment cost for treatment X will be $10,000. So the initial cost will be $10,000 plus for every year of my life, there will be $1,000 per year. So each year, I might have some consultations, some medication, which are going to cost, let's say, the healthcare system $1,000. Per 30 years, that means $30,000 plus the initial $10,000. We are going to end up with $40,000 for this particular branch. Okay. For the other branch, instead, no cure. The costs are the same, $10,000 for the initial treatment cost, and then $1,000 for each year people live. But of course, we're going to have a lower life expectancy here, so 20 years rather than 30. So the total cost for this branch are going to be lower, $30,000. For treatment Y, we got a bigger investment cost at the beginning, or treatment cost at the beginning, $100,000, and the yearly costs are the same as treatment X. So we're going to end up with larger amounts here because of the larger treatment costs for treatment Y. And what we do in a decision tree is then calculate the expected cost for treatment X and the expected cost for treatment Y. So if there is a 75% chance of getting cured, that means we can apply that probability to our costs. In particular, if I get cured, my cost will be $40,000, 75% times $40,000. And then if I don't get cured, I will incur, or the system will incur a cost of $30,000, and there is a 25% probability of not getting cured. And the total expected cost for treatment X are going to be $37,500, which sits somewhere in between $30,000 and $40,000. The same for treatment Y. You're going to end up with $129,000, which is again in between these two costs, which is these two total costs for the cure branch and the no cure branch. The similar type of calculation will apply to the benefits. So if I'm going to live 30 years after receiving treatment X and being cured, there is a 75% probability of being cured. So I will need to apply that probability, and I will need to apply the probability of not being cured to the life expectancy of not being cured as a result of receiving treatment X. And I will end up with 27.5 years. In treatment Y, instead, the expected benefit will be 29 years. Again, similar calculations, okay? You'll probably notice already that treatment X is associated with lower cost, but also smaller amount of benefit in a way, okay? So lower life expectancy. The same or reciprocal happens for treatment Y. So higher costs, but higher expected life expectancy for treatment Y. So we have this trade-off, which is typical in economic evaluation. You end up with a treatment which might be more expensive, but more effective because it brings about more life expectancy, for example, or better quality of life for the patients. And in session 5 in particular, you will look at putting everything together into a metric which is called incremental cost effectiveness ratio. I'll present it here for now, but we will look at that more in depth in session 5, so don't worry too much about this for now. The incremental cost effectiveness ratio is the difference in cost divided by the difference in effects of benefits, okay? In this particular case, we will end up with $61,000 per life year gain. So that's the incremental cost effectiveness ratio for treatment Y. If we want to produce, let's say, a life year, we need to consider that we are going to need $61,000. Okay. Whether that is high, low, is something we are going to discuss a bit more in session 5. Any questions?
So this is then an additional year regardless of the quality of this additional year then. That's the difference between quali and...
Yeah, usually, well, in the UK, we use a lot of quali. So rather than having a life year, you will have a per quali gained. Yeah, so, and there will be, I'm not going to reveal too much, but because that will be covered in session 5, but there will be a specific threshold where you can choose whether, for example, 61,000 is a good amount or not, okay?
So, this additional year, there will be additional evaluation of the quality, how good this life is. I mean, another additional study or evaluation, or
No. I mean, the value. You're asking whether that particular amount of money is worth the life year gain. Is this something we decide within an economic relation? Is that what you?
Yes. Yeah.
Okay. That would be something that is going to be discussed within the economic relation. Yeah. So we present the results usually, and then we discuss those results, whether that amount is acceptable or not. Okay. There will be wider consideration which go beyond cost effectiveness, though. But typically in economic relation, we will find some discussion around the acceptability of that amount from a cost effectiveness point of view. But yeah.
Yeah, thank you.
That's all right. Any other questions? Okay. Um, I'm going to present you the Markov model, and the Markov model will differ a bit from its decision trees. If you think about the decision tree, I'm going to go back here to this slide. Now, if you think about decision tree, they are quite simplistic in the way they present reality. Okay, so if you think about getting cured, for example, there might be other things we need to consider in the long term, like the risk of, for example, relapse. Okay, or if I don't get cured, the risk of developing some other comorbidities. Also, as people age, there will be an increasing risk of death just as a non-disease causes of death, so what we call background mortality. Okay, that means that you will end up adding more and more branches to this decision tree and will become quickly very difficult to handle. So rather than try to convert a very difficult prognosis into a decision tree, a lot of people tend to use Markov models in economic evaluations because we are trying to basically reflect these difficult prognosis, which might end up in complication, developmental comorbidity, and might end up in different types of levels of quality of life for the patients. So we're trying to reflect these different prognosis into a set of transition probabilities between different health states. And I'm going to show you this in this slide here. So rather than thinking about these different branches, we can consider just simply different health states, whether people are asymptomatic, whether they develop a progressive condition, or whether they die. Okay, this is a very simple Markov model where you have these three health states, and you consider your study population at different periods. So in year 0, there might be everyone as asymptomatic. Year 1, let's say, some people will have moved to progressive condition. And as you go on, more and more people, of course, will end up in this state, which is the absorbing state of death. Everything is controlled by specific transition probabilities. So if you're looking at the cycle at year 1, for example, so in year 1, everybody's asymptomatic. As you move to year 2, sorry, if you look at year 0, actually, everybody's asymptomatic. If you're looking at year 1, there will be a 67% of probability of people remaining asymptomatic, 16.6 or 17% probability of people moving to the progressive state, and again, a 17% probability of people moving to the death state. So from asymptomatic, we can move to dead or to a progressive, or we could stay in that particular health state. Each state is, of course, associated with different costs and benefits. So if I'm asymptomatic, I probably will not incur a lot of costs in terms of healthcare cost, and my quality of life will probably be better than being in progressive. Okay. So for each cycle, for each period, there will be different costs and outcome associated with the health state I'm going to be in. If I'm in progressive, there is going to be a 67% probability of remaining in progressive state, or 33% probability of moving to death state. If I'm dead, of course, 100% of probability of remaining there, unfortunately. So that's an absorbing state. Visually, we can probably look at this Markov model, or example of a Markov model, considering this figure. So where in cycle 0, a lot of people, or all of the people are here in the asymptomatic state. And then by cycle 8, or that could be a year 8 or month 8, depending on the natural progression of the disease, you'll have more people in the progressive state. And then by the end of your time horizon, of course, you will have a lot of people who have died, and some people in progressive state, and fewer people in the asymptomatic state. As I was mentioning before, you will have some costs and outcomes, in this case, life years, associated with each cycle. In this particular example, we got more than 3 states. So you can think of A as the asymptomatic state, B as the mild severity state, C as the high severity state, let's say, and D as the death state. In cycle 0, everyone is asymptomatic, and then in cycle 1, 72% of people will stay as asymptomatic, but then some people will have moved to the moderate severe state, some people will have moved to the highly severe state, and some people will have died. In particular, 99% of people will survive, so that means you got some 0.99 life years gained from that particular life year. Sorry, from that particular cycle. And as you move on, more and more people will move to state B and to state C, and eventually you will end up with a lot of people, of course, in state D, which is death, and you will only have, for example, 0.03 life years gain from cycle 20. So from each cycle, you can add up the life years gained, and you're going to end up with the total life years, which is nearly 8 life years from this particular intervention. So we are only considering one intervention here. And the same, you will have some certain costs associated with each cycle. So if people move to state B, they will have certain costs associated again with medications or particular interventions. And you will have to add up all the costs, and you end up with these costs associated with this particular intervention. And you can replicate the same calculation for the other comparators. The transition probability, so how people transition from A to B and B to C, C to D, will generally come from, for example, randomized controlled trials, if we're looking at short-term probabilities, or more longitudinal studies, if you're looking at longer-term probabilities. So if you're looking at background mortality, for example, you can get that from life tables, for example. Okay. Things can get a bit more complex, of course. We just presented a Markov model, which is quite simple, but in our example from the article on advanced Parkinson's disease, we have, for example, health states defined by the disease level severity, which is the HY index, but also the off time. So you can have different combination of these two clinical outcomes and depict a situation where people can move across, I think, 25 different states, okay? So this is just to show that things can be a bit more complex. And I'm going to conclude with this example, which is a discrete event simulation where things get even more complex, because rather than thinking as people as a cohort of people moving to different health states, here we are tracking individuals. So I'm not going to go into details into this example, but as an individual, you can enter a model and end up in different places into this specific discrete event simulation model. What is important to consider is that compared with a Markov model, here you can have a consideration around the history of a patient. In a Markov model, whether people were, for example, receiving reintervention and coming from this scenario or loss of patency, or this scenario was patent, wasn't really considered by the Markov model. So you didn't have any history regarding the patients. With a discrete event simulation, instead, you can track an individual history. You can track what people went through. So you can know that people going through a reintervention will have come, for example, from this particular scenario here. But this is very complex and will require a lot of data about individuals. So it's going to be very demanding from a data point of view. And typically, I would say Markov model are more common because of these data requirements, which are attached to a discrete event simulation model. I'm going to leave you the example here. I'm conscious of time, so I'm going to leave you with this slide. So now we wrote up the methodological info regarding modeling techniques, and I'm going to talk about the homework. So as part of the homework, you will have to fill in a table with key info on the key attributes of an economic evaluation. And we're going to ask you to complete this task by Monday, 16th of June. You will find the homework document on Teams. So if you click on session 2, and then you will find the document with your own name. you can open that Word document and you will see this table. So you'll have some information in the first 3 columns around the attribute we are going to work on. You're going to work on, sorry. For example, population. You're going to have a definition of population and where you can find a particular attribute within the paper. And what we're going to ask you to do is just extract the information from the paper. For example, you will be able to find the information around population and just copy and paste that information here in the last column, okay? And the same for the other types of attributes. Any questions, please let us know. We know from experience that it might be tricky to find some attributes, okay? So let us know if you struggle to find some of them. So that's it from today. I'm sorry we ran out of time, but if you have any question, I'm happy to stay online. This was our second session, and we are going to look forward to welcoming you session 3 in a couple of weeks' time. And again, please respond to the invite for the workshop if you haven't done so already. And I'll see you at session 3. Any questions, I'm happy to stay online. Thank you very much.